So today we want to focus on Medicare, getting to know Medicare, and we're going to be talking about the 10 most common questions that come up as it pertains to Medicare. What is Medicare? Who can get it? Do I need Medicare if I plan to work past 65? And that's a big question. We're going to drill down into that a little bit. What does Medicare cover? Where can I get more coverage? What does Medicare cost? How do I choose Medicare coverage? When can I enroll? When can I change my coverage? And how can I save money? We all want to do that. So first, let's begin with what Medicare is and what it is not. Medicare is a federal health insurance program for eligible U.S. citizens and legal residents. It's funded in part by the taxes you pay. As long as you've worked 10 years or 40 quarters, you've fully earned, entry in either at disability or as you age in at age 65, you've earned original Medicare. Individual health insurance, this is not a family plan or a couple's plan. Each person under Medicare has their own plan, even though some carriers offer some spousal discounts when you do something together, but they are individual plans. Medicare is not free. I've had some people walk through my office and be a little chagrined and taken back that what they had been paying into their whole lives didn't give them full entitlement to carte blanche medical care. A family health plan, it's not a family health plan. It's not Social Security. You can advance a retirement check, after age 62, or you could postpone out to 70 and a half, and it's independent of your decision to get on Medicare, which is you're eligible the first of the month you turn 65, whether you take a Social Security check or not, and unless you come in under a disability, a qualified disability. And it is not Medicaid. So what is Medicaid? I'm going to dispense with this and not spend a lot of time on it because you're working with Brophy Wealth Management. And if you're working with a financial advisor, you're not typically going to qualify for Medicaid because you're broke. Medicaid is typically available to low-income individuals who need some additional support. And the good news is if you do run out of money, there are these safety nets that exist under Medicaid. But the way to remember, Medicare is what you're entitled to as a payer into the system. And Medicaid, the word aid, is for those who need additional help. And they can work together. You can be eligible for both Medicare and Medicaid. So who gets Medicare? U.S. citizens and legal residents. Legal residents must live in the U.S. for at least 5 years in a row, including the 5 years just before applying for Medicare. You must also meet one of the following requirements. You're age 65 or older. You're younger than 65 with a qualifying disability, and any age with a diagnosis of end-stage renal disease or ALS, commonly known as Lou Gehrig's disease. You can, as we said, have both Medicare and Medicaid. Some people are eligible for both. We call them dual eligibles, so often known as full benefit dual eligibles or QIMBY plus, qualified Medicare beneficiaries. Medicare and Medicaid work together to help contain your healthcare costs. And there are a number of levels of Medicaid, or what's also known as extra help. Do I need Medicare if I plan to work past 65? I want to take a little bit of time here because that was one of the questions that people focused on after the seminar in revisiting the slides. Many people are aware that you are penalized for not participating in Medicare when you first come eligible, but there are exceptions to that. You may be able to delay, or you may have to enroll at 65, depending on your situation. So generally, you can delay Medicare past 65 without penalty if the employer has 20 or more employees. The employer health coverage is considered creditable, which means that it's at least as good as what's available under Medicare. You need to enroll at age 65 if your employer has fewer than 20 employees. So if you're self-employed or you are part of a small office, like my employees here at Dublin Health and Benefit, we have 12 employees. We are not considered required to be COBRA compliant. We're under 20 employees. So somebody in my office would need to sign up for Part B. Or in rare instances, there are large corporations that do not have a plan that is considered creditable. It may be so old that it's grandfathered and does not meet the criteria for being at least as good as Medicare. You can find out whether your plan is creditable usually in your employee handbook. I would say most plans, my experience, maybe 98, 99% of the plans are creditable out there, but you should check if you're going to postpone Part B under a large group environment. But there's that example of the 85-year-old who his wife worked for a large company. He did not need to sign up for B, yet he did, and he paid for it for a long time unnecessarily. Getting Medicare while still working. So in some instances, you could have a creditable plan at work, but based on the contribution your employer is giving to the plan, it's not sufficient to compare to what you could have individually. This is a deeper dive. All I will say is, if you're going to be a working agent beyond age 65, I'd encourage you to call our office. We're going to give you the right answer, whether we sell you a product or not. We're going to evaluate what your employer is paying, what it costs to have a spouse on a plan. And one word of caution is, many people who have a husband and wife on a plan, and let's say it costs $200 a week to have a husband and wife, you might draw the conclusion that 100 is attributable to your wife and 100 is attributable to you. In many instances, the employer may pay 100% of the employer cost, the employee cost, and that $200 is all attributable to your wife, and it may be beneficial to look at an individual Medicare plan, even if you're going to continue to work beyond that. But just to keep things moving along, if you're faced with that decision, don't hesitate to call my office. We can help evaluate what strategy is going to be best for you. So what does Medicare cover? There are two parts, Part A and B. A involves an overnight stay in a hospital, and B is everything that Medicare covers that is in Part A. Some examples might be a doctor visit, an X-ray, a CAT scan, some labs, durable medical equipment, walkers, canes, sleep apnea machines, beds are all Part B. Part A, you just want to remember, always involves an overnight stay in a hospital. They put a wristband on you and slap you in the bed. Part A covers hospital stays, including your room and meals, care in special units like intensive care, all the prescription drugs and supplies, tests and x-rays, operating room and recovery services, skilled nursing services, blood transfusions, hospice care if necessary, including pain management, part-time skilled care for homebound, and rehabilitation services after a qualified inpatient stay. It's premium free as long as you've worked 10 years or 40 quarters. Some people are eligible but pay a fee. You can't be denied coverage. Coverage is nationwide. Coverage costs per benefit period, which is a benefit period is defined as the day one in a hospital and having been not out of the hospital longer than 60 days in a row, or any skilled care facility is a benefit period. You must be admitted as an inpatient under Part A as indicated, and it provides 60 lifetime reserved days. Medicare Part B covers doctor visits, outpatient care, including annual wellness checks, flu shots, clinical labs, x-rays, MRIs, ambulatory surgical services. If you're in the morning, out at noon for an orthoscopic knee surgery, for example, durable medical equipment, mental health care, counseling, psychotherapy, that kind of stuff. Diabetes screenings and education, physical, occupational therapy, speech therapy, and the like. Monthly premium is adjusted for income under Part B. We call this the IRMA adjustment, income related monthly adjustment amount. The standard amount, if your income is below 194,000 as a married couple or 97,000 as an individual, Part B premium is $164.90 for those under those thresholds. That's probably 85% of the people out there. If you're above those thresholds, it tiers up all the way up to $560 per month each if you're over 750,000 in joint income, or roughly half that as an individual. And there are different levels between the 194 and the 750 that you'd pay a little bit higher Part B premium. So just be aware of that. Original Medicare doesn't cover everything. All of the cost of your care, you have out-of-pocket costs with no limit. Prescription drugs aren't covered with Original Medicare. Routine dental, vision, or hearing are not covered. Eyeglasses, contacts, hearing aids not covered. Long-term care or custodial care. So skilled care is helping you recover mental and physical skills after an accident or say a stroke or an illness. Custodial care is what we think of as long-term care or nursing home care. And there are other solutions, and that's a different discussion for once you get into a custodial care or you want to explore understanding what options are available to protect the downside of a custodial or nursing home long-term stay. But A and B does not cover that. Excess charges by doctors who don't accept Medicare assignment and care received outside the US is not covered under Original Medicare. So this is where we come in. We help you understand. I always joke, everything that's in your mailbox, if you're anywhere near 65, that's filling up. Or if you watch TV for any length of time, you're seeing a lot of information about plans for seniors. There are basically two paths. Option one is a supplement path with a standalone prescription drug. These Medicare supplement are also known as Medigap policies. They're designed to help you backfill the gaps in Original Medicare. Option two is what you're seeing a lot of lately, is these managed care programs known as Part C. And what it does is it bundles and combines Part A and B and all the services you'd get under that, and often includes a Part D prescription built right in, and may offer additional benefits like vision, dental, hearing, over-the-counter medicines, and the like. So everything you see on TV or in your mailbox is really one of these two paths. And a lot of time when you call our office, we spend about an hour and a half really drilling down into these two paths before making any decisions. But many people think there's 100 different decisions that need to be made. Really, all of the plans you're seeing out there fall into these two categories. Medicare supplement with a standalone prescription drug, or a Part C Medicare Advantage, which is a bundled product. So all Part C Medicare Advantage plans cover everything required under Part A and B, and most cover prescription drug plans. And then we talked about they often have some additional bells and whistles: dental, cleanings, x-rays, eye exams, hearing tests, fitness programs, and memberships. There are many types of managed care plans. A couple of them you're probably aware of are participating in now, either an HMO, point of service, PPO. There are also special needs plans for people who might have chronic illness or are dual eligible, or they're in an institution. There are private fee-for-service plans and medical savings account type plans. We can help you understand all of these. This isn't designed to make you an expert on the many choices that are available today, but just to whet your appetite about the various types of Medicare plans out there. These are the requirements of participating in a Medicare Advantage. You must be enrolled in both A and B. You can't be denied due to health status. You may be required to work within a network of providers. Coverage costs vary by plan and carrier. There is an annual limit on the out-of-pocket maximum, so that's a key component since original Medicare doesn't have a ceiling on your out-of-pocket maximums. Many charge a monthly plan premium. Some are as low as zero cost. Must continue to pay your Part B premium to Medicare. Prescription drug coverage. You can get that one of two ways. You can get it as a standalone and perhaps alongside a supplement, since supplements do not embed Part D prescription. Or you could have it built into an Advantage plan, as we illustrated earlier. Medicare Part D plans cover types of drugs most commonly prescribed by Medicare beneficiaries, and CMS, or Centers for Medicare Service, does track that, and they want to make certain that people have access to the types of meds they typically need. Specific brand name drugs and generic drugs are included in a drug list called the formulary. The formulary guideline is that every plan must offer at least two choices in every therapeutic environment, even if the only two choices are, specialty drugs that treat cancer and they're $12,000 a month. Every plan must offer at least two choices in every therapeutic environment. Commercially available vaccines not covered under Part B, like shingles or this new RSV respiratory, or the COVID vaccine, are typically covered under Part D. There are, very much like your group plans or individual plans on healthcare.gov, there are different tiers or levels of drugs from tier 1 to tier 5, 1 being the least expensive, 5 being the most expensive. There are 4 stages to all Part D plans. The deductible stage, if any. The initial coverage stage is stage 2. That's the first $4,660 in retail value of the medications. And while you're in this stage, you're typically paying a copay associated with the tier. Some people out there have heard of the donut hole or the coverage gap. That's when you're beyond $4,660. About 13% of seniors fall into this category, and they're cost sharing at a discount. You pay 25% of the cost of the med until you hit $7,400 max out of pocket. And then in year end, you move into stage 4, catastrophic, where there's some cost sharing involved. Now, one of the big changes in 2024 is that in 2023 and prior, you continued to pay the greater of 5% of the cost of your med or a copay, whichever was greater. So if you're on a $12,000 a year med like Ibrance that treats stage 4 metastatic breast cancer, you would, even after you hit the $7,400, likely be paying $500 a month for that med. But in 2024, they're doing away with cost sharing in stage 4, which means that your stop loss will really truly be capped at $7,400 in 2023. It's going to $8,000 in 2024. So you must be enrolled in Part A, Part B, or both to buy a Part D plan or buy an Advantage plan. May be required to use a network pharmacy. Coverage costs vary by plan. One of the things that we do for our clients each year, with your permission, is run your meds to determine where we're going to find the best value for the meds that you're taking. So that's a good reason to work with a broker that can evaluate that with you each year. It's the most volatile part of your plan, even if you like the health side of it. Your drugs change, the formularies change. All of these components are kind of fluid, so it's a good idea to evaluate your meds each year. Part D premium penalty for late enrollment. If you're on a creditable plan through work, you won't be charged that. But I've had people say, I don't take any meds. Why don't I just not buy a Part D plan? I'll buy it when my butt's on fire. And The reality is that you can get a Part D plan as low as $4.20 a month. It doesn't make sense to mitigate that risk on your own, and you avoid the penalty by just having a placeholder plan. And if you do need a med during the year, you don't have to wait till the open enrollment to put the fire out. You have some basic coverage. So we do recommend a Part D plan, whether you take meds or not. Medicare supplement insurance. These plans are very accessible in terms of you can see any doctor or hospital anywhere in the country that accepts Medicare. And they're portable. If you buy it in Massachusetts, New Hampshire, Vermont, wherever you are, you can move to Florida or California, take it with you, keep it your entire life. That's some of the pluses of a supplement plan. They're offered by private insurance companies, and one of the things that we do is look at all 23 carriers bringing product to New Hampshire or Maine or whatever state you're in, and evaluate where the value stories emerge. These are standardized plans, by the way. So, for example, a G plan is going to be contractually identical whether we buy it from AARP United Healthcare, Humana, Anthem Blue Cross, Harvard Pilgrim, or the like. We are independent brokers, and we contract with all these carriers so we can help you evaluate value stories that exist in the marketplace and talk about what might be the right path for you when the time comes. Continue with supplement Medigap. These plans help pay for all of the gaps in Medicare, of which there are many. And it puts a cap or a ceiling to the out-of-pocket. These plans do not cover prescription drugs, dental, vision, hearing, eyeglasses, custodial care. We talked about nursing home care or long-term care. These are the plans that are standardized. They're plans A to F. And this is just a chart that talks about the various components that make up each of these plans. I'll give you a quick answer to what most people do when they choose a supplement. And I'll preface this with about half go supplement, half go advantage plan for their own reasons. We help you educate yourself so that you can come to a solid conclusion about what's going to work for you. But those who choose a supplement, about 98% choose a G, or if you're born prior or you aged into Medicare prior to 1/1 of 2020, you can still buy an F plan. And the reason for that is it's the only plan that covers Part B excess charges. That's balance billing. And there's not a lot of difference from some of the other choices in G or F. It's a matter of $25 to $50 a month. So the G and the F will cover balance billing if a doctor's billing above Medicare approved amounts. So that's just a fast track to why 98% choose an F or a G when they choose a supplement. Certainly the other half of the people that are not choosing supplements are looking at advantage plans with the additional services they provide. So you have to be enrolled in both A and B. There is no medical underwriting for the first 6 months. This is something that's a misnomer. Most people think the annual election period permits you a free pass into anything you want, coming and going. It does not. The supplement plan is only available to you in the first 6 months without medical underwriting. After that, you can buy it at any time, any one of 12 months a year till you're 102, as long as you can answer the medical questions. But as we all know, the older we get, the more challenging it is to pass medical underwriting. So for all practical purposes, the first 6 months is really the only time you're assured of a Medicare supplement plan. After that, then it doesn't matter what happens to your health. They must continue to offer the program to you as long as you pay the premium. These plans have national coverage. Any doctor, any hospital, anywhere in the country that accepts Medicare will accept any supplement plan.
And let me ask a quick question on that last slide there.
Yeah.
If someone applies, let's just say their initial at 65, they go on to United's Medigap plan, and then they develop health issues. do they have to stay with United, or would they be, do they have to answer?
Yes, they would have to stay on the United plan. That being said, all of these plans are entry age driven, meaning the rate is tied to the age you enter at. So it's not typically something we recommend migrating away. These supplements are typically long-term strategies. If you come in at 65, you're not likely to get a cheaper plan from another carrier when you're 70, because you're older and sicker. Age and health don't usually go together.
So actually,
But excellent question. That's why most people don't shuffle around. Now, in Advantage plans, it's an entirely different story. People will migrate from product to product, year to year, depending on what their needs are. Some plans have more robust hearing benefits or dental benefits, and if this is your year to have a whole bunch of that done, you can move from one to another and back again during the annual election period.
Sorry to jump in as well, Ken. Just that was one of my questions that James asked, but to sort of expand a little bit, if you were on a Medigap policy for a couple of years, you signed up during the enrollment period, everything's fine, but you wanted to get additional coverage by going to an Advantage plan, would you have to go through underwriting at that point, since you're leaving the Medigap policy to go to an Advantage plan?
Yeah, you would not. You can move during the annual election period, and there is no medical underwriting to come into an Advantage plan. Furthermore, there is a 12-month free look when you leave a supplement plan. If you move and you decide, oh my gosh, what did I do? I hate this. You can get back to the supplement plan you left without evidence of insurability within 12 months. So there's one opportunity to give it a try and come back to it.
Okay, great. Thank you.
So Part C plans and Medigap costs, many plans have low zero cost premium. They typically don't have a deductible, some do, but most don't. You might pay some token co-pays or cost shares along the way as you navigate care. Part D plans are often embedded, and they do operate the same whether they're embedded in an Advantage plan or as a standalone alongside a supplement plan. Part D plans have a monthly premium, although typically that's embedded in a Advantage plan C. Even a zero cost plan with a D component is still zero cost. Supplements require a standalone, and the cost is anywhere from $4 to about $100 a month, depending on what your needs are for formulary access. So how do I choose? I'm going to blow by that and just talk quickly about option one. What I like about Medicare supplement plans: any doctor, any hospital, anywhere in the country that accepts Medicare, so it's as accessible as you can get. That's what people like about them. What do they dislike? Sometimes the premiums. You can pay, somewhere between $150 to $200 a month at entry age 65 for a supplement plan G, which is the most common. Medicare Advantage plans, what do people like about that? It combines A and B services. It includes prescription drug coverages, and it provides the additional services we talked about. And it's hard to, beat starting off January 1st with a zero cost premium, which is as low as Advantage plans go. And they have some decent zero cost plans out there. How do you choose? That's what we spend a lot of time with you, helping educate you when you meet with us. We'll try to understand what your needs are. You're going to hop in a camper, drive all over the country. You're going to go to Florida for 6 months. Some people will never leave Bedford. Those types of decisions will guide what we might recommend or help you get involved with. So I've kind of covered this slide by virtue of the last statement. Some of this is a little redundant. You do want to understand a couple of things about enrollment. Your initial enrollment period is the 3 months prior to turning 65, the month you turn, and the 3 months after. You're entitled to sign up for Part A and B. You may not want to if you're going to continue to work, particularly for an employer that has over 20 employees and is primary. You can postpone that. There's no penalty. to postponing after age 65. But if you are going to enroll, call us early and enroll early, because there's 10,000 people a day aging into Medicare in this country. That, by the way, in my opinion, is why it's hard to get anybody to do anything today. It's not because kids don't want to work. It's because there were twice as many of us kids working 40 years ago than there are coming up. General enrollment period. If you miss the enrollment period, you can come in between January and March of every year. But you'll probably pay a penalty if you didn't have any creditable coverage. Open enrollment period for supplements is the 6 months prior to turning 65, or when you first become eligible for Part B, you get, if you're a working agent, you get 8 months. So if you leave a job at 67 with creditable coverage, we can make some decisions anytime within 8 months of you leaving the job. Usually you don't need to wait 8 months, or you wouldn't want to wait 8 months and not be properly insured, but that's the window for both Medicare Advantage and supplements. We're just about done for those who might be running out of time. The late enrollment penalties, it's 10% for Part A. If you have a Part A fee, most don't. It's 10% for every full 12-month period you've missed Part B without having creditable coverage through an employer. And by the way, healthcare.gov is not counted as creditable. You must move to Medicare if you're in healthcare.gov. And COBRA is not creditable, so you can't choose to stay on your company's COBRA plan for 18 months, then come to Medicare. You can strand yourself if you do that. Do not do that. If you're leaving a company plan, it's time to talk about Medicare. COBRA is not creditable. Part D penalty is 1% of the average Part D plan, which is about $33, 1% per month. So if you're 10 years on the sideline, you're going to pay 120% of $33 for 2023 for the rest of your life if you don't get on a plan early. That's why we recommend having a Part D, even if you're not taking medication. And you can change your coverage between the annual election period, October 15th to November 7th each year. And we are working round the clock at this office during that period of time. Nobody's allowed a vacation. And then there's also a Medicare Advantage open enrollment, January, February, and March. So let's say you choose something and you don't like it. You can change from one Advantage to another, or you could leave an Advantage and go back to original Medicare and get a Part D prescription. Special enrollment periods typically involve a move or leaving a retiree or union coverage. COBRA coverage, they have it listed here. It's wrong. You can leave a COBRA coverage, and if all the stars align, you'll be okay, but you can strain yourself by using COBRA when you're eligible for Medicare. Saving money, this is all about using preventive services, making sure you're in network if you're in an Advantage plan. Ask about generics, use plans, preferred pharmacy, because these drug plans have both preferred and generic, preferred and standard pharmacies. So that's the Sermon on the Mount. You can go to dublinhealth.net and contact us if you have additional questions.